Finance Budget Report, Health Plan Reserves. Administration will provide an update for the board on the development of the district's 2016-17 budget. In follow-up to the budget presentation on February 8, 2016, tonight's presentation will focus on the district's self-insured health plan and a review of options for use of non-general funds to increase health fund reserves. This item provides an opportunity for the board's information and discussion.
Good evening, Mr. Freeman.
President Arnold, Superintendent Allison, members of the board, thank you for this opportunity.
So rare.
It's not very often that I'm asked to provide something and I walk away thinking, I don't think I can do this. To restore the health plan reserves without using general fund dollars, it was a real challenge. But after having some conversations with our consultants and some other things, then we did get some work done. But I'll try and move through this fairly quickly so that I don't get tased from the back row. Got to have a little levity here, especially with what I'm going to talk about. As I started working through the data and looking at developing options, I had to make some assumptions, that we are going to finish this fiscal year with the reserves I've projected, and you'll see those in just a minute, and that the information that we're getting from our consultant, our USI consultant, on savings and some things will hold true. And the last bullet point is where I got to the point where I could provide an option that met the charge, that mid-year plan changes are acceptable. In my mind, in dealing with benefits and that sort of thing, I've always worked off of the plan year, and you can't make changes until you get them. But there are certain things you can do in the middle of the year. So, and you'll see how that changes. The other thing that I've done is I've violated one of my basic rules of putting way too much on the screen. But I felt like it was important for you to look at a lot of numbers here, but this is my projection to the end of this fiscal year with the healthcare reserves. And you don't need to go down and try and read through all the numbers and that sort of thing. I'm going to point out a few things to you. The very bottom right-hand corner in the yellow, that's what my projection is for the end of this fiscal year, the reserves, $10 million. And point out that we started at $20 million. Okay, so we've dropped about $10 million if my projections hold true. Now, the way I did that, you can't hardly see it on here. There's a shaded area in here where all the numbers are the same. Well, those are all averages of the months ahead of that. So that was the best way for me to make those projections. I'd also draw your attention to some other numbers on here down in the bottom left-hand corner in the green. Those numbers are larger than everything above it. A couple of reasons why. The total revenue, the $11,500,000, that's when we pay the teacher contracts out, and so there's actually 3 payrolls in there. So the amount of revenue coming into the fund from those payrolls is 3 times what it normally is. That's why we get that big jump in there, because you can compare that up to the very top of that column, where July and August and the revenues are very low. And then the $5 million amount is in the retiree. That's where we're using the first half of the trust. We are actually going to bring that revenue in and pay for the retiree expenses in that month. So this is the FY16 projection, and if it holds true, we'll wind up with about $10 million left in the reserve. This is the FY17 projection if we don't make any changes. And I wanted to show you this so that you understood what will happen. We start with that $10 million up here, but by the time we get to September, we're already in the hole. And the hole just keeps getting deeper and deeper and deeper, so that by the time we get to May, we hit a $12 million in the hole figure. and it pops back up a little bit, again, because of that big influx in June of the extra payrolls and the last half of the trust being used. So this is why we need to do something with this. Now, back up to this. We're dropping this, and this was really, we knew this was happening. This has been going on for about 3 years now, but 2 years ago, before we were under the block grant, we were getting some additional revenues coming in with additional enrollments and those types of things coming in. So we didn't start addressing it then. Then last year the block grant hit us, and to get into this year's budget, we didn't address any of this because we didn't want to have to cut staff that year without any planning going ahead of it. So we knew this was happening, but we're now to the point where we're going to have to make some changes. So what did we do? What did I work on in terms of developing the option? To avoid general fund dollars, I decided that we're going to have to implement some changes on July 1, 2016. That's this coming July, if we're going to try and make the option that I'm going to show you here work. Some changes that will have to be done in January, just because of enrollment issues. And to build the reserves, and I've said this before, either revenue must increase or expenses must decrease, or it's going to be a combination of the both. And the revenues can only come from the general fund, which we're not considering at this point in time, or employees or retirees. That's the only places where the revenue can come from. The revenues from retired employees can be implemented on approval of the board. However, the revenues coming from regular employees have to be negotiated. And the expense reduction, we can accomplish that through plan design changes, and I'll show you how that'll work here in a little bit. But what happens is we are shifting expenses from the plan paying expenses, to the employees that use the benefit paying those expenses. So, again, to talk a little bit about what's negotiated and what's non-negotiated. The things that we can do without going through negotiations is plan changes, deductibles, coinsurance, prescription copays, network design, and the retiree premiums. The board can authorize those changes. What would require negotiation is the cash option, the dental plan, regular employee premiums, and spousal coverage. Those are things that we'd have to take through negotiations. So, revenue option considered, and notice there's only one. Because the charge is to not use any general fund money, and because we have to negotiate a regular employee change. So this is all retirees. So this is looking at changing the retiree premium, which currently is $648 per month with wellness points, to the tiered system that you see down below that, $531 for retiree only, up to the retiree family of $1,647. This change, if put in place, would generate about an additional $1.7 million in annual revenue. Understand that still doesn't cover all of the retiree expenses. We're currently covering about half of it with the $648 per month. So we're about $5 million of retiree expenses. So we're covering about 2.5 of it. This would get us a little bit more. So we're getting closer, but we're still subsidizing the retiree expenses moving forward. Plan changes that we're going to consider to lower expenses. First, I looked at increasing the deductible. Right now, it's $850, and you can see what I have there, moving it to $2,000, $3,000, and $6,600. The amount of lowering of expenses that would occur if those plan changes were put into place. And again, when we raise the deductible, that means the employee is paying more of those expenses until the insurance actually kicks in. Another way to do it is through increased coinsurance amounts. And again, this is the out-of-pocket max on the coinsurance percentages that are there. So Currently, it's at $3,000. So once you're paying through that coinsurance, the 70/30 coinsurance, if we raise it to $4,000 or $5,000, it generates those amounts that are there. Third thing that I looked at was the prescription copays. Currently, it's $10, $30, $50, $100. That's $10 for generic, $30 for a preferred brand or formulary brand, $50 for a name brand, and $100 for the high-cost prescriptions. And this is really 10% of the cost of that prescription up to a maximum of $100. So, and we have some people that are getting injectables that are several $1,000s a month. So that's how that one works. What I looked at and analyzed was moving it to the 15, 40, 60, and 150. That generates a little over $1 million in annual savings. As savings to the plan, not to the employee. The other piece we looked at is requiring the use of the Aetna point of service network. It's a 2.7 annual savings, and this is the one that would have to start in January. Now, the difference here is that to move to this network would mean that every employee would be required to name a primary care physician, and that the primary care physician would then be the one that would recommend or refer to specialists and that sort of thing. And actually, most of our employees that have doctors that are primary care physicians, so it wouldn't be a huge shift, but it would be for some that don't have that primary care physician to start with. So those are the plan changes that we had considered. Now, what I did in terms of looking at determining options, and I actually did look at several combinations of revenue increases and expense decreases. And then as I looked at it, I decided I needed to project out actually the fiscal year 2018 because as I was looking at the numbers, you don't always hold the savings in 1 year. Partly because I applied a 5% inflation factor to the claims. National trend, according to Aaron, is about 8%. We typically run better than that, so he suggested I use a 5% inflation factor. So that's built into that, so I decided to go out 2 years with the projections just to make sure that we were going to be able to maintain those reserved after the retiree trust is gone. So I looked at 3 options were analyzed, but only one option restored the cash reserves, and that's what I'm going to show you now. This is another gulp moment. The only option that I looked at that I could analyze was to increase the deductible from $850 to $6,600 and require the POS network in January and change the retirees to the tiered premiums. What that does is it leaves the June 2017 ending cash balance at $17.6 million with average monthly reserves of about $5.4 million. Now, remember back when I showed you the FY17 with no changes, we were $12 million in the hole in May, okay, and then it came up to about $1.5 million negative then. So this turns around the decline of those cash balances, and you wind up with about $17.6 million. The challenge with the monthly reserves, because they jump up and down, understand that we are paying about $5 million a month in expenses. So that really, on a monthly basis, it doesn't give you a lot of wiggle room. The other thing is that this option, although it does get us back up to that 17.6 at the end, it's a little bit risky in FY18 because as those inflation numbers start to kick in more, the projected June 2018 reserves drop to $11.1 million. So you've from the 17.6 you built up because of the inflation factors, you're going to drop it to by $6.5 million in that next year. So. And while we can get there with this option, we unless some other changes happen, you won't be able to stay there. So My concluding remarks. The option presented will replenish reserves if claims costs don't increase more than projected. So one of the things, too, that happened in this most recent January is we changed, we're on the Aetna platform now, and we're also on the Maxor prescription drug platform now. We expect some of our costs to diminish a little bit, but it'll be a couple more months before we know where those projections will hold true. If they do, and we don't see any more inflation, then this option will probably work. The only challenge is that it will not sustain the reserves in future years without some other changes along the way. So we kind of kick the can down the road a little bit. So that's my report.
Okay. Few questions here. And let me go back to your first page. To sum it up, without general funds, we are on a trajectory to go broke by the end of 2017, our insurance plan, if we do nothing.
Correct.
Okay. Now, the options that you listed were all options that where there was no negotiation.
Correct.
Do we know on those negotiated items, if we were to take a look at some of those, do we have an idea? As an example, the cash option. How much these would provide in terms of revenue for the plan? Do we have any idea on the negotiated items?
I do have data from our consultant on what those, as the various things that we looked at would generate. I have numbers on what each one of those, the cash option, the dental plan, the premiums, the spousal coverage. I have numbers on all of those, yes.
So I guess what I'm kind of wondering is what it would look like if we had a balance between the two. I mean, I look at the figures on the things that we don't have to negotiate and the cost that's passed on to the employee. Do we know if a perfect balance can be created somewhat?
There's the opportunity for a perfect balance, but I also need to remind you, we don't even begin negotiations till April.
Yeah.
So we'll be well into where we need with budget, and to not know by that point in time, because the option to use general fund will necessitate making further cuts to program and positions. And waiting until May, late April or May is going to make that difficult. So the timing is tough for us. I think at this point in time we would have to develop a budget without any of those dollars as a potential, because we just don't know what may or may not occur.
And I appreciate that, and thank you. I think it's my point in asking that is it's critical, I think, for employees to understand what it is we're facing. And our insurance plan going broke by the 2017. I mean, that's a harsh reality. But we have, I think everybody's on here, so we're going to start. We're going to start with Mike Rohde.
I realize you're the messenger,
I'm the messenger.
and I'm not going to shoot you. And I'll protect you from getting tased.
Okay.
I got your back. I did a little math, and this scares me. I took your plan for a retired family. The premiums are $19,700 a year. The deductible is $9,600 if you use it all up, for a total of $29,000 in 1 year. Possible if you do something dumb like I did this year. That's tough.
Well, yeah. You start looking at all of the numbers, and you take the $6,600, for an employee, and you look at the amount of dollars that it saves. On this slide here, and you see the big jump from the $3,000 deductible of $5.2 million to the $6,600 of $16 million. What that is telling us is that most people will never hit the deductible. Okay, and as with the retirees, you're probably not even going to get there, if it's set that high. That's why this is, for me, was a real gulp.
Right.
To have to understand what this is going to be. So,
Is there any way to know how much we're using in deductible and coinsurance? Because a lot of people don't consider coinsurance. They see the deductible and don't realize it's another $3,000 on top of the deductible for your coinsurance.
we have that data from last year's claims service, claims data and that sort of thing. And moving forward, we can track it, so we know what. And that's part of where Aaron's projections come from, is from actuarial studies and from the actual claims data. Yes.
So we don't hit those magic numbers with the coinsurance and the deductibles.
Probably not.
Okay. Well, that's a little easier to swallow.
Yeah.
Thank you, Jim. I appreciate it.
Barb?
I have a question on the retirees, and I think I know this, but I don't know that I know it. Made a lot of sense, didn't it? Retiree retires at 60, and do we keep them covered till 65, and then they go to Medicare?
Yes.
And they must go to Medicare?
Yes.
Okay. The other thing I wanted to know on the chart, retirees only, I think it was 87, the spouse and the children. So the one that takes the retiree and their spouse, which is most likely what we might be covering, would be 1,116?
Yes.
Okay. I've got it. Thank you.
Mm-hmm.
Lynn?
Like I say, that's almost right on the money for what I pay for retiree, for my wife and I on ours. And that's been a big issue for us to look at. I guess the question I have going along with this is, have we looked at what our cost would be if we're forced to go to the state plan? I know that's going to be the high deductible, and we've always looked at their plan as much more expensive than ours. They're, as far as I know, they're still talking about, it's highly possible that it could be a July 2017 introduction, force everybody together, which I think would be a huge mess. But do we anticipate any idea what that would cost us?
Not at this point in time.
I mean, they have no premiums yet that I'm aware
No,
of. They think it'll save money.
The last I heard last week is that they're going to bring in several of the largest vendors and begin to do a little deeper dive. I think there are a lot of questions on how A&M came up with the numbers they generated to start with. Mm-hmm. And it's all vapor at this point in time.
But based on the governor's
even have
plan
any
for what the
speculation.
current state employees were going to face was the highest deductible. Is that correct?
It would look very similar to what we've proposed as our option.
The high ones, okay. Thank you.
Cheryl?
Okay, again, just a clarification, because when I saw the 6,600, my mind took a vacation. We're really looking at that on your slide on revenue options for retirees. Your proposal is taking us down to that retiree premium increase per month for the retiree only at 531, correct?
Correct.
And moving on down to family at 1,600.
Mm-hmm.
Our current retirees pay 648 a month.
Mm-hmm.
So if you're retiree only, you get a decrease.
Correct.
Why are we doing that?
Well, the premiums that you have there are based on the actuarial claims for those, the way those tiers work at 125%. So The fact that we've got retirees paying $648 per month now is to try and cover some of that, the spouse and the children and the family. So, there's no magic to it. It's
So
just a number that's picked.
we just have one number no matter how many
Correct.
people they bring to our plan?
Yes.
All right, I'm
Yep.
with you now. And it is possible for someone to retire and only take themselves, even though they have children and spouses?
Correct. Yes. It's their choice.
Yeah, but we don't allow that with our regular employees. Because the cash option, I mean, they can take a cash option, but can they take it just for themselves and not for anybody else?
Yes.
But why would they do that now?
Well, that's just exactly it. Why would they do that if they can get everybody in their family covered at no cost, the way it currently is? But so we don't ask them to choose at this point that tiered coverage because we don't really have it. We can calculate the tiered because we, through the claims and through the insurance carrier, third party administrator, we know who's single, who's family, we know all of that data. So that's why we can project these numbers out here. But the way that it's offered to employees right now, it doesn't make any difference to them.
Okay.
So
My next question then is, going along those same lines, we have an employee that's an employee only, and they have a deductible of $6,600.
correct.
We have an employee who has 15 kids and a wife, and they pay $6,600.
No.
Okay, tell me.
That deductible, then, if you go to a tiered system, then that deductible becomes $13,200.
Okay, so a family with
have
a spouse and 2 kids are now paying $13,000 in deductible?
That's the deductible if it's anything above a single.
So
so-
this is only single only?
Right.
That $6,600?
Correct.
And if it's just a spouse, is it $13,000? If it's a spouse and 15 kids, is it $13,000?
Single is $6,600. Anything above single is $13,200.
Wow.
And let me remind everybody, this is not a recommendation. This is not what's happening. This is without general fund because of the flat is not flat, block grant funding. This is a possibility, given the parameters. No general fund, no changes in anything beyond what you can control. This is what it would have to be to balance. So this gives you an idea of worst case scenario in what's there.
Without anything that's negotiated.
Without any
Right.
general fund or any type of negotiated aspect, yes. I just want to make that clear so that, particularly for our media that's here, this is not the recommendation.
This is not the recommendation.
This is what's going to
Information.
happen to our employees. This is the example of the limited nature you have to impact the plan. And that because of over time, as Mr. Freeman said, with new students and those types of revenues, we've been able to adjust our plan and maintain it for the past several years. With those options no longer part of the block grant, this is the reality we face. So that's more for our audience to understand. This is a point of conversation for you all, given those parameters.
Jeff?
I know it would be unpopular, but have you thought about having the employees pay a premium? Would that help this out at all, or?
Certainly, another revenue stream. But again, that's for our 2 unions. That's a negotiated item.
I understand
Yes,
that,
yeah.
but when you're looking at a family that has a $13,000 deductible, and I could pay $1,000 a month or something to keep my insurance, I would certainly look into that. But that's something we have to negotiate.
Correct.
And these
Good luck.
numbers, if you had, as Mr. Arnold said, a a balanced aspect of the various, these numbers look different, you know,
Absolutely,
deductibles,
yeah.
those types of things would definitely change. But you'll also remember, as we've talked about the budget projections, this was the big ticket item on why, you know, we're looking at a low end of 15 and to 25 million in what we'd need to cut. This was the single largest item in that projection.
Cheryl,
Yeah,
you have
I'm
another
sorry,
question?
I have one more question, and it's for the superintendent, because you talked about we do not start negotiations until April, and I understand that fully. But is that forcing us into making this kind of a decision now? I mean, not this tonight, but at some point before we even start negotiations?
I think it's going to force you into looking at contingencies. So option A, option B, option C, depending on what would potentially happen with negotiations. Just like we always have to do, because we don't know at the time we're developing the budget, you know, salary
we're gonna get it.
increases, steps tracks, what our revenue stream is. So that's why we have to look at that low and high. We typically look for what we hope is somewhere in the middle, and then hope that we don't have to go that far. And that's what we'll have to do again this year.
Yeah, this is why they pay us the big bucks, right?
Exactly.
Okay, I think you've succeeded in making everyone nervous up here, so thank you, Mr. Freeman.
You're welcome, I think.
Mike, we're ready for our next item.